The Living Well at School is a school health working model to be embedded into the school ecosystem. It is implemented by teachers as part of their daily work. The working model is designed to activate and sustain healthy eating behaviors among students and their families. It is important to cultivate healthy eating behaviors from young. A HPV study found that 7 out of 10 children who were overweight remain overweight at adulthood. Obesity is a major risk factor for chronic diseases like diabetes. We found that the model is effective in activating and sustaining self-motivated healthy eating behaviors in students. It is also effective in activating and empowering parents to enable healthy eating as a family. Apart from this, we found that it is bending the curve on new incidences of obesity among children. This project is a collaboration with MOE. MOE has decided to scale it to all primary schools in Singapore. We are supporting MOE on training of teachers. We hope that this project can complement existing efforts to promote a healthier Singapore.
The team started by finding out what our patients wanted after knee arthroplasty. Patients expressed that they wanted to go home earlier after their surgery, but wanted better support. The team co-created a bundled package to ensure a holistic multidisciplinary care model, which supported patients throughout their entire journey from hospital to home. We partnered our community partners to take over the post-surgical home visits to ensure an efficient and seamless transition for the patients into the community. The length of stay for knee arthroplasties in SGH was reduced from 4.55 days in 2018 to 2.92 days in 2022. The number of patients who benefited from the home visits also increased from 22 in 2019 to 629 in 2022. So apart from knee arthroplasty patients, we are also looking to see how we can do something similar in other populations in a slightly modified model. Firstly, collaborate with others as much as you can. Healthcare can be complex, and working together is key in pushing boundaries, challenging norms, and also providing holistic care for the patient. Secondly, always find out from patients what they want, as they are the experts for their own health.
Now, this innovation empowers patients to recover better in their own homes. To staff, there is satisfaction when patients are happy and when they recover better and faster. AMK Specialist Centre, or AMKSC, is a strategic site of Tan Tock Seng Hospital, focused on innovating and testing new cost-effective care models to bring care closer to residents and minimise hospital visits. For example, our transdisciplinary diabetes care model features a clinical diabetes educator service who function as physician extenders, providing necessary diabetes care services and empowering patients to better understand and self-manage their conditions. Through a protocolized care collaborative model known as IMSK, or Integrated Musculoskeletal Therapy Services, general practitioners and polyclinics can refer patients directly to be treated by AMKSC's physiotherapist or occupational therapist. Our community eye clinic service is part of a national initiative to provide more accessible and affordable eye care in the community. Our audiology team had trialled a new portable audiometry system without the need for a soundproof room at AMKSC. Our day surgery centre has procedural suites to perform a low-risk cataract surgery procedure in a community setting. Moving forward, we hope to build more collaborative pathways with our primary care partners in the community to right-side care in the community for our residents in Central Zone.
This digital innovation is actually our first digital twin hospital in Singapore. We can now represent every single patient in different parts of our hospital in a very large tertiary hospital in Singapore. And this system is actually integrated with different data sources, which will allow us to not only visualize but also predict future outbreaks from occurring. What is even more impactful is now we will be able to use the same digital twin to scale it to other use cases, such as pathfinding for our patients, simulations of different scenarios on the ground, and also to improve operations in our hospital. And this will definitely impact our patients and our staff.
So 4D-DOS is a 4-dimensional disease outbreak surveillance system. So this is a system that's specifically developed to detect infectious disease clusters in different parts of the hospital. So the hospital environment is quite complex with multiple floors and different wards. What we have done is we extract information from the electronic health record database and we build in algorithms that can detect surveillance clusters. And we built a digital twin of the hospital. So we integrate the electronic data onto the digital twin. So it gives a signal of where the problem areas are in terms of infectious disease transmission. And this can be reviewed on a day-to-day basis for us to be alerted to infectious disease outbreaks.
OT-Site is a data-guided approach for workforce and process transformation. OT-Site triangulated high-value factors influencing efficiency and productivity. It was conceptualized to manage the increasing surgical workload given resource and operational constraints in a complex and dynamic operating room system.
OT utilization rates improved from 86.8% to 100% without corresponding manpower increase. This was contributed by a significant reduction of OT turnaround time and late starts, efficient processes that shorten patient processing by 24 minutes, and core transformation of our OT culture.
A patient-centric and seamless journey from signing the consents for surgery to their recovery process at home. For staff, an enhancement of teamwork, culture, and work satisfaction through communication and an all-hands-on-deck campaign.
The rapid transition to digital platforms and constant adaptation to new processes during COVID presented challenges to our multi-generational administrative staff. This triggered the need to develop a program to upskill our people digitally, provide work support, and improve productivity.
The program and process innovations provide a good breadth of learning opportunities through self-directed and experiential learning, focusing on productivity hacks, quality improvement knowledge, and innovation projects.
The results have been very promising. For our improvement projects, we managed to save about 70% of man-hours on average and a whopping 95% of time savings for our robotic process automation projects. We must be relentless in the pursuit of improvement and innovation so that we can adapt to changes readily.
The team will continue to educate and expose relevant digital skills and technologies to our administrator community by developing and delivering contextualized content. We are also looking at deepening experiential learning by encouraging more colleagues to participate in improvement and innovation projects going forward.
Because of the aging population and the diabetes epidemic, the number of patients with retinal conditions requiring intravitreal injections as part of their treatment was increasing exponentially. This nurse-led project allowed us to rapidly scale up manpower efficiently and safely to meet this growing demand.
This initiative reduced patients' waiting time and offers a safe and cost-effective alternative. Engaging nurses in specialized procedures enhances our professional growth, thereby boosting our confidence and job fulfillment.
Last year, our department performed 12,000 intravitreal injections. Of this, around 70% were performed by trained nurses. The injection workload has increased 13% year-on-year, and this initiative has supported the growth in workload. We aim to increase the number of trained nurses to take up 80% of the workload. We have also developed a training and accreditation program which we will share with our partner hospitals for their journey into nurse-led intravitreal injections. My advice is not to be afraid to challenge existing norms and perceptions. Focus on the ultimate goal, which is to improve patient care and safety.